Welcome back. Let's start learning about some structures in male reproductive organs, shall we? All right, so I've got three different pictures here to show you the external structure. Starting over here on the left, this is a view of the anterior of male with the penis amputated here and the skin on the front of the scrotum cut off. So this is the scrotum here. The middle picture is a midline almost view, not quite a midline, but almost a midline view cut through the pelvic area, showing you contents of one scrotum as well as the penis, as well as internal organs. And then this picture on the right is just showing you the male reproductive organs with everything else removed. Also showing you the urinary bladder, of course. All right. So the first structure is the testis. So notice we use the word testis and not testicle. Testis is the medical term. Testis is the singular form. If the I is changed to an E and it's testes, that's the plural form, meaning two testes. Okay. The testis, as you know, is inside the scrotum being the hair-bearing, hairy part of the skin. And the testis is covered by this thick white capsule, which goes inside and actually divides the testis into compartments. And inside the compartments is a structure which is going to be the site of sperm production we'll learn about in a later video. All right, so everywhere where there's a green arrow, that's pointing to a testis. Now, with the blue arrows, each of these structures is the epididymis. So you can see that the epididymis is located above and behind the testes. It's comma-shaped. So when the sperm are made in the testes, they will then travel through ducts and show up next in the epididymis. And they stay in the epididymis quite a long time, several months. And this is where the sperm mature. All right. When they're ready to be called to duty, the duct inside the inside the epididymis down here at the bottom leads to the next structure with the red arrows, and that is the vas deferens, sometimes called the ductus deferens, but we're going to stick with vas deferens because cutting the vas deferens is where the word vasectomy comes from. Ectomy means to cut a piece of. Vasectomy, cutting a piece of the vas deferens. And so the vas deferens carries the sperms back inside the abdominal cavity. So if you look at this middle picture, you see the vas deferens goes through an opening in the pelvis. And then it goes on the side of the bladder, and it's going to go to the backside of the urinary bladder. And so it gets carried not just by itself like these two pictures on the right show, but as the picture on the left show, the vas deferens actually is surrounded by some muscle fibers as well as the testicular artery, which is coming down to bring blood to the testes, and the epididymis, as well as this whole meshwork of veins that surrounds the testicular artery. And its job is to pre-cool the blood coming down to the testes. Because the reason why the testes are outside is so that they're cooler. So we don't want hot blood going down to a cool testis. All right. So now let's look at internal structures. The picture on the right is the same picture on the right. The picture in the middle is the same picture in the middle. So the only picture that has changed is the one on the left. And it actually is the picture on the right, but looking at it from behind. So you have the urinary bladder from behind. You can see the vas deferens coming back right here and here. All right, so the next structure with the dark green arrows is the seminal vesicle. So the seminal vesicle is here at the base of the bladder posteriorly, and it's just on the outside of the vas deferens. Okay. And this is going to be the first of 3 organs that are going to be adding secretions to semen. The second organ here with the pink arrow is the prostate gland. It is about the size of a walnut that is still inside of its shell, and it's located right below the urinary bladder, as you can see in all 3 pictures. So it's the second of the 3 organs that are adding secretions to semen. If you look at the prostate, what you will notice is that the urethra from the urinary bladder has to go through the prostate. This part of it is called the prostatic urethra. So let's look at the middle picture. You can clearly see the prostatic urethra right here, but what you will also notice is that there is an opening over here on the left side. You can see the opening coming from the seminal vesicle joining the opening coming from the vas deferens, the 2 going together to form this structure right here, which is known as the ejaculatory duct. And so the ejaculatory duct is going to carry the sperm from the vas deferens as well as the secretions from the seminal vesicle, and both of those will then empty into the distal part of the prostatic urethra before they continue the rest of their pathway. So the third and final structure, which will add secretions to semen, is known as the bulbourethral gland, which can be seen with all the purple arrows. And it is actually located in this muscle layer, which is just below the prostate gland. So it's this little gland right here. And so this muscle layer right here is kind of like a sling at the bottom of your pelvis to kind of keep everything up. Super important in women, as we will see in a different series of slides when we do female reproductive. The bulbourethral gland, you know, it's a long word, hard to spell. It's named that because it's between the bulb of the penis and the urethra. The other name for it is Cowper gland. So, you know, Cowper gland, a lot easier to spell. Feel free to use that term instead. And it adds a gelatinous, slimy secretion to the semen. All right. So our last structure is the penis, and I do the penis separately because it has both external and internal components to it. So it doesn't really fit on either of those previous slides. If we look at the penis, you can notice all these blue areas. All these blue areas are cylinders. There's 3 different cylinders of erectile tissue, kind of areas that look like sponges. And all the holes in the sponges are areas that are going to be filling up with blood, as we will learn in a later video. Going the entire length of the penis is the urethra. So this part is called the penile urethra because it's in the middle of the penis. The head of the penis, it's not called the head of the penis, it's called the glans penis. And you can see it with the red arrows that it has a slightly larger diameter compared to the shaft of the penis. And if you look at these 2 pictures, notice that it is completely made out of this spongy erectile tissue. Okay, and notice it's not gland as it's secreting stuff, it's glands, no D in that word. And covering the glans penis when you are born is a skin covering, which you may have called the foreskin, but the Scientific term for that is the prepuce, seen here at the end of the purple area. And this can be removed with the circumcision, as seen in the picture here on the right, where there is no prepuce anymore. Okay, so with that, we are done with all the structures. So take your time, review all the organs as well as other structures that were named on the previous slides, and then follow the pathway of sperm from its origin to the outside, and then see if you can do the sperm pathway as well. Okay, and I will see you shortly when we come back, and we will be talking about what's in semen.